Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic office. I'm here with my lovely girl here, and she does lifting. So let's talk about hip hinging, so stay tuned. Thanks for watching. Let's talk about hip hinging. Hip hinge is a movement right within your hip joint versus the waistline. Okay. So as you're squatting down, if you do an extension of your lower back and you actually bend back at the waist, you're gonna hurt yourself. So before you hurt yourself, your brain's like, what the heck? Starts giving the load to all the other parts of you, and you become more limited, and you will end up hurting yourself because you're in competition. Okay. So what you want to do, let's practice this. Those of you who are watching, this is a good time to get up and practice this. Hip hinging is literally going to your hips, pushing them back without extending your torso. So you're gonna go back and lower your seat. So you see how when you do it this way, your feet came up, you started leaning backward. That's because you haven't done it. With practice, it can happen.
That's
so
why I always feel like I'm going back.
Yeah, that you're going backwards, right. So what we want to do is we want to hinge. You want to keep the lower back in a neutral position, meaning you're not going to be having so much of a curve. You want to make it as limited with the curvature as possible.
Okay.
So you want to make sure you're standing up straight. Keep this neutral, which means a slight tuck under, slight. Now we're going to hip hinge backward. Keep that there and lower your tush. And try to balance yourself. Relax that. You want to, this is a good one. So we want to relax the scapular area without very good fix. Keep this going. Relax this, open this up, hold your arms up and lower yourself. And that's how you're going to condition. Your knees are too far forward, so you're going to have to move everything back. So instead of bending forward like that, you're going to keep the knee stacked on top of your ankle and actually lower yourself that way. That's hip hinging back. And try to sit backward, not using your torso to balance. Keep the upper body neutral, keep the lower back neutral, and sit back like that. And try to, like in my case, if I go farther down, my knee's going forward, which means I'm doing it incorrectly. So I'm not going to do it, but that becomes my goal. So pay close attention. The world was not created in one day. So you're going to be going back, hip hinging back, and just hold it there correctly. So let's do this. Spread your feet a little bit. Very good. Bring the foot there, hip hinge back, and sit back. Hold it right there. Relax your scapula. Open this up. Try to balance. Just like that. Now you're going to use your glutes to lift you up and hip hinge back. So you're not doing this and using your lower back to get you up. You're using your glutes to lift you up. Let's do it again. Okay. Hold it there. This is too much extension. Fix that. Hold it. This is a challenge. Now the key here is to try to stabilize the knees just like that, and so you're not shaking side to side, because that's how you're going to end up hurting yourself. and then you use your tush to lift you up. So hip hinge back, hip hinge forth. This is a great practice for those of you who are doing lifting, so that way you don't injure your lumbar spine. Thanks for watching. Make sure you subscribe to the channel. Thank you so much. Love. Subscribe to the channel and shoot any questions you have. Take care.